Kia ora and welcome to a special episode of No ME, where we discuss the oral submission. ANZMES provided an oral submission on May 3rd to the House Select Committee as a follow-up to our petition and written report. So a warm welcome to Wendy Matthews, who is a fellow Executive Committee member of ANZMES, to Emeritus Professor Warren Tate, and Royal New Zealand College of GPs fellow Dr. Sarah Dalziel, as we discuss the presentation and what we hope to achieve with this petition. Warren, what are your thoughts about the oral submission that we've just been to?
Well, I thought firstly you did an excellent job. It was very clear. I think it was compelling, and I think that was received well. And, you know, perhaps, my disappointment was sort of the lack of questions. I thought there might have been a question about Maori involvement, so that was quite good. At least we got that. And I'm glad Sarah and I were both able to get to say something about that, because, I thought I'd better jump in quickly. Otherwise, I might have missed out totally. But, many other things which I'd hoped they would have raised, where we could have commented on. That was disappointing. I have to say, listening to Martin Chadwick, I've contacted Martin Chadwick about long COVID and including MECFS and whatever. I find his response so frustrating, really, by saying, well, all of the services are available. And, it's just not stepping out and understanding what the needs of the individual patients are and how that might be bridged. So long as you've got a process in place, it doesn't really kind of matter what you call it,
No, exactly. And that's why I said at the beginning of the presentation, I basically provided a rebuttal because I had read his written submission, so I knew what he was going to say.
Absolutely. And
so I had to get it out there. I had to let them know that actually what he's about to say is incorrect. In reality, okay, the policies might be there. The long COVID conditions policies are all set up for healthcare. But in reality, when a person with ME gets to the health system, they are declined.
Yeah.
I even have someone with severe ME at the moment who was declined from Wellington Hospital referral from her GP because the person who used to do it there has recently retired and there's no one else. Now they're just throwing up their hands. No, you're declined.
Can I just add, and then I'll let Sarah come in. But, my most severe patient in Dunedin, who's, in a darkened room and the same sort of thing, has been very severely. The family asked me if I'd write a submission to the GP because he wanted some cerebral spinal fluid and now, assessments done, and they were sensible, and so I knew about these, but I did some research and I wrote a very careful thing. It went to the GP who endorsed it and sent it to the neurologist, and they've just got a response that they don't want to see him. They don't want to, and
too hard basket.
Yeah.
Yeah, and it's so frustrating. So, these are the stories. They may be anecdotes. If we had the funding from the research, we'd be able to give them the actual data. But it's time and time again, people aren't getting services. Wendy, you're experiencing that at the moment. Do you want to touch on that a little bit?
Yeah. We get a little bit of home help, which is great. If we'd had that at the beginning of my illness, even a little bit would have made such a difference. I don't think I would be where I am now, or my daughter. And I'm going to have to go this morning after I've talked here and wait for 15 hours probably in ED before I can get this tube put into this nostril, because it's been in there far too long. It's been in there 9 months, and they just said, well, that's way too long, but it's like you fall through the system. So now I'm feeling pretty sick and hot and horrible, but that's what I've got to do to get through. I could have gone to a clinic, had an appointment to fit me into a clinic to get this done, but because I'm so chemically sensitive, they won't see me unless I have a rat test. And I saw my doctor yesterday who said I didn't need to have that test, that she could certify that I didn't have COVID. I'd seen her, but unless I had it, they won't see me at the clinic. So, you know, that's the upshot. You could say, okay, that's my fault for not having the rat test, but I just react to so many chemicals that it's just not really an option for me. It's even when I was in hospital for a month, they didn't make me have one. So yeah, you know, we need provisions made for us. Listening to that today, I just felt so disappointed. I felt you'd all spoken so well, but I felt the patient community's voice again was not heard. That they've got their they've got their thoughts prepared. They stick to their story. They're not prepared to change it, and basically we bounce around between departments from one to the other because nobody knows where to put us. And until we get that classification, and until something happens, it's not just hundreds of us, it's thousands of us that are really unwell and actually suffering quite a lot, are in this position.
Wendy, can I just say I really admire your courage in appearing in the Stuff story that was, I know in the Christchurch Press, I've had copies sent to me and the Post. You know, I think that's what you've done just to, you know, I think is a very effective way of communicating the difficulties patients have with this illness, and I know how difficult that is. So I admire you greatly for doing that.
That's lovely. Thank you, Warren. Unless we speak out, nobody knows. And it's just a shame that those that are so sick have to fight for themselves. They haven't got the energy to fight for themselves. We need these people that are designated by government to be our advocates, to be there for us, to step up to the mark, and they're not doing it.
No.
That was the disappointing thing, I think, was, and, you know, perhaps they were just taking the information under advisement and they're going to discuss it as a group, the House Select Committee. But yeah, I was disappointed at the lack of questions. How did you feel about it, Sarah?
Yeah, I agree with all that. And sorry, Wendy, it sounds like you've got a horrible day ahead of you. So yeah,
we'll get there.
Not that long, yeah. Yeah, I think it was unfortunate which order it all got presented in, because I think if we'd been able to present last in the queue, then we would have had more opportunity to, that rebuttal that you put in there, Fiona, would have been, you know, heard better. And agree with Warren at the Martin Chadwick and the Ministry of Health, you know, they're probably all in cahoots and they've got sort of direct access, and it's an ongoing frustration for lots of things in primary healthcare, is that we don't have a voice, and that's even more apparent with things like MECFS, where, you know, it's hard to find GPs, or not all GPs have got a good understanding of it, so it's even more harder to find a voice in more fragmented health services. I guess the only positives that I did feel was that there was, based on the question at the end to Martin Chadwick, there was a acknowledgement that being classified as a disability would provide some better support, or better access to some support. So he did acknowledge that.
That was really important, that both Whaikaha and Martin Chadwick both acknowledged that actually changing the classification would make some difference. So I think clearly from Whaikaha it was that it fits the criteria for disability, but doesn't fit the criteria for disability services. So you have to also be intellectually impaired or be on the autism spectrum or something like that, as well as having ME, in order to classify for their disability services. So how can they make it just, you know, tweaking the criteria so that actually ME is just included, and then that way then we can have access to those services. And, you know, Martin said that the definition would be is more, a social construct, is about, accepting ME as a disability from the fact that we need home help services. So obviously it's just a social construct. But he did recognise that it would enable clearer access and a clearer pathway. So that was really positive.
I guess the other positive thing about that was at the very end of the presentation. It was that question was asked and that he said that. So hopefully they remember that going forward when they're discussing this. But yeah.
It was good to say, well, classifying as a disability will help the mental health of the person. I was frustrated by just almost focusing it down to that, because to me the most important thing is that it will affirm the illness and all of the people that you have to deal with. At the moment, there's all of this, well, this is an illness, what is it all about? It's like the designated doctors, who I know several people who had to go to designated doctors to keep their disability allowance, and it was cancelled because the doctor said there was no way these people couldn't work full time when they'd been, homebound for 20 years. It's just a nonsense. So if we have the label of a disability, then maybe people will accept validation of the illness, which isn't being accepted now. So it's not only the mental health of the patient, it's the mental health of all the people that they have to deal with, really, that will benefit from that as well. And
absolutely, it's legitimising the condition as it's disabling, debilitating disease.
Yeah,
I think the other disappointing thing is that with all the different health reforms, is that the new health of disabilities strategy and things, it's all kind of, it's only being established, and there's a lot of transitioning to Te Whatu Ora and so on and so forth. So it's nobody really, and they're just sort of passing the buck, really.
They're using it as an excuse, aren't they? I mean, this is not a new issue. We have been lobbying for this for decades. So now the excuse is, but we're forming, so our focus is on formation and getting new policies and procedures in place. It's like, yeah, but on a daily basis, people with ME, and we're looking at, up to 40,000, potentially 70,000 if you add in all the people with long COVID who fit the criteria, who aren't getting access to these services, who are getting declined, and Martin Chadwick saying you don't have to be classified as disability to access them. Well, it's simply not true. And, we've provided that testimony. We're showing them. We have the anecdotes.
As I know, I've told you before, Fiona, but the others may not know, when I heard that Martin Chadwick was dealing with this long COVID development of the platform, I contacted him directly and talked to him about MECFS and just making sure that if a platform was going to be developed for long COVID, not to, forget that long COVID was an MECFS like illness, and it's only got its own name because we've had so many cases of COVID and so many cases of long COVID had come up at the same time. I had the same frustration with him there, that he was very polite, but he was very reluctant to almost accept ME in the same room as long COVID, and was very lukewarm, gave a very lukewarm response to that ME people have to be included in this national platform, and of course I talked about education and medical schools, so that actually all young doctors were emerging with very good knowledge,
Yeah, and ANZMES also made contact with him at that time and put forward your name and Dr. Anna Brooks' name and Dr. Rosamond Belling's name, Dr. Sarah Dalziel's name, saying these are the experts about this post-viral syndrome. You're going to need them on your advisory to help you inform the practice for long COVID. And it didn't happen.
No.
Unfortunately, the GP who is on that committee, I don't know him personally, and I think his heart's in the right place, but I have heard him say that, well, I actually don't know too much about this in the first place, but I'm the kind of the person that the Ministry of Health uses. And so I'm already involved on various committees. So yes, they asked me, and, you know, that's how that happened, which is kind of not a very good process for...
No, and that's what they're doing. They're keeping their same little unit and not learning from new people, not bringing new people in to widen the breadth of knowledge and expertise. So they're never going to learn if they're using people who don't actually have the knowledge in the first place.
The chair of the Medical Exemptions Committee, when I was trying to get them to give exemptions for those people that had had adverse reactions to vaccinations, you know, I was amazed. I said, you know, do you know anything? Because I'd put a submission in, I'd been asked to put a evidence-based paper, and I asked them, have you read the submission, which I did with Roz, and have you read the evidence paper? He said no, they were supposed to. I was told they were going to actually deal with it, you know, a week later. And I said, do you know anything about ME? And he said, well, no, not really. And so I gave him an ME 101 lecture for about an hour and a half. At least he listened graciously. And then I said at the end, so are you going to do anything about this now? And he said, oh, well, actually, I don't have the authority to do this. And that's the frustration with the ministry again. Sorry, you go ahead, Wendy.
Yeah, sorry, all I was going to say was that, you know, there seemed to be about 4 people that asked decent questions, and they were good questions, and they showed an empathy.
Yeah.
But listening to those 2 speak, there was no empathy. There is no connection between the ME community, and it's just there in a glaring way. They have no connection with us. They are coming out and they're speaking about something which you can see, A, they don't understand, 2, they really don't want to understand, and 3, they just pass us off to somebody else. Nobody really wants to take responsibility for us.
No. I mean, I think we've just got to, you know, just what you've done, you know, by appearing in that Stuff article, and what I'm trying to do is we've just got to keep trying in any ways that come up. I mean, when Michael Baker was giving a talk about, you know, long COVID and post-viral illnesses at the symposium, I contacted him and said, you know, again, I just thought I'd give you some facts about ME, just because I don't know how much you know about it. So I actually sent him a lot of material, and he was very gracious. He came back and he said, I'll put some of this in my talk, you know, and there were a couple of slides, at least on ME, that directly came from basically what I was sort of telling him. So, you know, I think we just have to keep doing those kinds of things. And I know, you know, Fiona, I'm always just in great admiration when I see what you're constantly doing. And I, you know, when I got access to my computer by this morning, I was able to read the things that you had sent through, and you know, I think that's fantastic. And you know, so I think we've got to give each other a pat on the back in whatever capacity we're working for this, that we're doing very worthwhile things. And I think eventually, hopefully, it will reap the benefit, even if not immediately, you know, for sufferers, you know, in the future.
That's right. And obviously the Health Select Committee are still going to be talking amongst themselves about and making a decision and putting out their report. Yeah. So there's obviously still hope that they're going to listen and to make the recommendations, and that's perfect. And that is actually what happened in 2012 as well, when Wendy submitted a petition. The House Select Committee back then said yes, ME should be reclassified as a disability. The next step is for the government to actually listen and implement that, to make that change, and that's what we need. And so, you know, after this, obviously we're going to put this podcast out I think next week, and then you know, I'm going to be publishing the full speech on our website and to our social media, so that we get a bit more traction and out to media, because we need to keep talking about it. We need to keep the dialogue open, and we need to be inviting the people of, you know, like Martin Chadwick, Ministry of Health and Whaikaha, to come to the table and to actually talk to us about it and get that lived experience and that knowledge from all of us.
at the political level, I mean, I assume Shane Retty was still, you know, sitting around the table. I was disappointed as the health spokesman, you know, for the National Party. He didn't actually have any questions about it. I was hoping. I actually in the past have taught Aisha Verrill, so maybe, you know, I need to kind of do a little bit more work directly with her.
I just want to say a huge thank you to you, Warren, and you, Sarah, and to Roz, and all of you that have actually just given up so much time and fought so hard for us. I mean, I don't know what we would have done without you, and it's just wonderful. Thank you so much for everything that you've done, and you, Fiona. You work jolly hard. I don't know how you do it all, and you do such a great job. So thank you.
So do you, Wendy, and I'm always amazed, you know, knowing your situation, your story, and that when I ask you a question, you're there to answer it, you know, and to give advice and help, and I appreciate that. And I take my hat off to you, because you obviously are much more severe than I am, and I have really bad days. So you know, I'm amazed at what you're able to achieve for us, and I know that you do, because it's important, and you might do it to your detriment sometimes just to get the message out there, and you have to recover after you've spoken to the media, or, you know, whatever, and it might take days or weeks to recover from that one interview and that one person coming into your home. But we are very grateful for everything that you do. And yes, Warren and Sarah and Roz, it's, you know, tireless effort. I mean, Warren, you're always in contact with media and with the ME community themselves, answering emails and phone calls, because they feel like they're heard when you speak with them. You know, you understand the condition so much, and you have so much empathy for them, and it's truly amazing. So thank you.
Thank you so much.
You know, it's a privilege, just to reply to Wendy particularly, it's a privilege for me to be doing what I'm able to do. Of course, I'm driven by the fact that I'm doing it for my daughter and my wife as well, who, you know, are quite badly affected with ME, and because I've sat on the sideline and watched it for 30 years, and I just know how debilitating it is. And I have my young university women study group, and they're just lovely young women who are, you know, trying to find their way in life with the limited activity. So, you know, I don't need any stimulus around me, any more stimulus to keep working on this as long as I possibly can, you know, until I drop, as it were.
Thank you. Thank you very much, everybody, for your time. And I really appreciate you being part of the oral submission today as well, Warren and Sarah. So thank you. We will find out how it all goes, probably in a few weeks. So thank you very much.
Good.
Thanks, everyone.
See you.
Bye.
Thanks, Fiona. Bye.
Yeah.
Thank you.
Bye-bye.
See you.